Hi, good morning. I am Valimar Basul and I am going to demonstrate to you the procedure of topical administration. A topical medication is applied locally to the skin or mucous membrane. Topical skin or dermatologic preparations include ointment, pastes, creams, lotions, powders, and sprays and patches. This medication is for diaper rash, wounds, burns, dermatitis, and other skin conditions. It is used to decrease pruritus or to treat local or fungal infection. We are going to assess first for the need for topical administration. The part is clean, redness, rashes, swelling, and discharges or abnormalities on the administration site. Client's level of consciousness, any history of allergy, and availability of medications. In planning for topical administration is we are going to aware the patient, organize supplies and equipments such as the medicine tray, warm water or other specified solutions, clean towel, a sterile gauze, squares or cotton balls, gloves, and medication card. And then we are going to observe the correct time, we recall guiding principles, and obtain appropriate medication. The first procedure is we are going to gather the equipment. Firstly, it is to prevent overreaching. Next is we are going to check each medication order against the original physician's order according to agency policy. So this helps to identify errors that may have occurred when orders are transcribed. Next is we are going to know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse reactions of the medication to be administered. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Next is we are going to perform hand hygiene. It prevents spread of microorganisms. Next procedure is we are going to obtain and prepare an appropriate medication for one patient at a time. So this prevents errors in medications administration. Next is we are going to prepare the required medicine if it is a powder, lotion, cream, ointment, paste, spray, or patch. Place the prepared medication and medication ticket on the medicine tray. Next is we are going to bring the medication to the patient's bedside carefully and keep the medication inside at all times. This prevents accidental or deliberate disarrangement of medication. Next is we are going to ensure that the patient receives the medications at the correct time. Check facility policy, which may allow for administration within a period of 30 minutes before or 30 minutes after the designated time. Next is we are going to prepare the client. So firstly, of course, we are going to ask the patient to state his or her name. Check the name on the patient's identification band. If the patient cannot identify him or herself, verify that the patient's identification with a staff member who knows the patient for the second source, and then complete a necessary assessment before administering medications. So identifying the patients ensures the right patient receives the medication and help prevent errors. Next is we are going to explain the purpose and action of each medication. It is to educate the patient about his or her medications. Next is we are going to assist the patient to a seated position or if not possible to a sideline position or position of comfort. It is to promote the comfort of the patient. Next is we are before applying the dermatologic preparation, thoroughly clean the area with soap and water and dry it with a patting motion. It is to ensure that the area is thoroughly clean. Next is when going to use powder, you have to make sure that the skin surface is dry. So this minimizes the potential for powder to cake and crust. Next is we are going to spread part any skin folds and sprinkles site until it is covered by a fine thin layer. Cover the site with a dressing disorder. Covering site prevents soiling of patient's folds and linens. Next is if we are going to use a creams, ointments, paste or lotion is firstly we are going to warm and soften the preparation in gloved hands to make it easier to apply, prevent chilling. Softening makes topical medication easier to spread. Next is we are going to smear it evenly over the skin using long strokes that follow the direction of the long hair. This prevents irritation of hair follicles. And then next is we are going to explain that the skin may feel somewhat greasy after application because some topical medication contain oils. And then next is we are going to apply an sterile dressing if ordered by the primary care provider. Next is if we are going to use aerosol spray, is first we are going to shake the container to mix the contents. Then hold the spray container at the recommended distance from the areola 6 to 12 inches. Next is we are going to cover the patient's face with a towel if the upper chest or neck is sprayed. And then we are going to spray the medication over the specified area. And then if we are going to use a patch, we are going to select a clean, dry area that is free of hair. Hair can prevent the patch from sticky to the skin. Next is we are going to remove the patch from its protective covering. Touching the adhesive side may alter the patch left on the patch. And then next is we are going to apply it, pressing firmly with the palm of the hand about 10 seconds. Pressing firmly for 10 seconds ensures that the patch stays on the patient's skin. Next is we are going to remove the patch at appropriate time, folding the medicated side to the inside so it is covered. Folding sides together prevents accidental contact with the remaining medication. Next is we are going to remove the gloves and perform hand hygiene. Removing gloves reduces the risk for infection, transmission, contamination of other items, and hand hygiene prevents the spread of microorganisms. And then next is we are going to document each medication given. Documentation helps ensure patient safety. The next is dispose all supplies appropriately. It should be put in their appropriate receptacles. And then lastly is we are going to evaluate the effects of the medication. The patient needs to be evaluated for therapeutic and adverse effects from the medication. That's all for today. I hope you guys have learned a lot from my demonstration. Thank you so much and stay safe everyone.